It is 6:30, so we will now call to order the meeting of the Wakefield Board of Health. We will, any public participation? Either here in the audience, on Zoom, bottom right. She's my bottom right.
I think we have Leslie. Leslie, are you I think you might be the only public participation tonight. If you wanna go.
Yeah. Go ahead, Leslie. You wanna unmute?
Oh, I think she's still muted.
Yeah. Oh, she's looking now.
Okay.
Okay. Sorry about that.
Okay.
Okay. Too many buttons.
Tell us about it.
Oh gosh, and I think I just upgraded, so it all looks different. What I'm inquiring about, it sounds
Leslie,
like,
excuse me, Leslie, before you start, would you state your name and your address, please?
Sure. Leslie Scott Lyson at 76 Montrose Ave here in Wakefield. As I think I heard you referring to with Erin about having the website have the health reports for the restaurants.
Yes.
Yeah, I have the draft all set to go. I think we're just, I need to get all the reports on a flash drive and then over to communications and she can post them.
Okay, that's good because I think you are aware, Erin, that I've been working to push this along for about a year now.
Yes, I am absolutely on board with this.
And and I hope there's going to be history and not just the most recent reports.
No, it's just going to be, well, 2024 and places that are currently open, because if there's no risk to public health, currently their report is not going to be posted.
Okay, well, what I'm saying is that if a place has a history of issues, that's part of what someone like myself, who is immune compromised and has been hospitalized for infections, has to watch out for, because as you folks all know, and I've heard you say, it's not a snapshot in time, but it really is a pattern of issues with inspections. And I think it's important for the consumer to be able to make those decisions on their own.
The inspections for open establishments will be posted from January 1st, 2024 to present, but we're not posting anything before that.
Okay, that's fine. That's fine, because I think that's a really big step forward, because I'm so happy that you folks are now much better staffed and that there's more regularity as far as inspections, because I don't think you had a full-time inspector.
No, that's not true. That the Wakefield establishments, they have been inspected on their risk-based inspection schedule since at least like 2013.
Oh, okay. It seems like there's been recently many more issues in the past.
I think maybe it fell off a little bit with COVID.
Yeah, okay, that's what I mean.
Yeah, but I mean, Wakefield has always had a robust food safety program.
Okay.
Ruth Clay and Coral Hope worked very hard for a long time on the FDA voluntary standards.
Okay. Because I know one thing that was pretty shocking recently, and I'm sure you folks will be talking about it, is the Brothers closing, and they were blaming the former owners.
Well, I don't plan to discuss Brothers tonight. They are, that's something we're kind of working with them on. But I don't plan on discussing Brothers. I don't think they're on the agenda.
Are they currently in compliance?
They are currently in compliance.
Okay, because I remember seeing the report and I was like, well.
Yeah, but remember, all of this, we're really education focused. We do not want to shame restaurants.
No, I get that.
We don't want to ruin anyone's reputation. We really just want to focus on education and the foodborne illness risk factors.
Well, my observation about how they explained it, though, they were blaming the former owner, which would say to me, you should have done more of your due diligence.
Yeah, I'm not. Yeah.
There are consultancies that people go to when they open restaurants to help avoid these issues. So that's it. Well, I'm happy with that. I'm happy to hear it.
Yes, we are. We're not going to do a food grading system.
No,
I have a lot of mixed. I have a lot of feelings on food grading. I think overall, it's not really an accurate way to reflect the inspection results to the public. I think it's
I agree with you.
trying to make it easier than it is. It's really complicated to do a food grading system, and also apples to oranges, right? Like you're comparing
Right.
chunks to Sakura. Doesn't
Yeah.
really.
Sadly, I've gotten very familiar with these reports, and I agree with you in that because as someone who is immune suppressed and has had other family members and have cared for cancer patients, I know for a fact what sorts of things I need to be watching for.
Yeah, and unfortunately, like with small children, like we don't eat out a ton.
No,
like
no.
it's a risk you're either willing to take on or you're not. So
Yeah. Yeah. Well, I have one child who's a bone marrow transplant survivor, and she had to eat aseptically. And if we ordered pizza, if she wanted pizza, we got a pizza, but we had to tell the place, do not cut it because the slices are never cleaned. I mean, that's how careful we had to be. So, and due to those exposures. So, it's this medical school of hard knocks I've gone through. I know too much more than I ever wanted to know.
Thank you very much, Erin, and thank you very much, Leslie.
Erin, it's in all seriousness, my offer stands. If you need a second set of eyes, I was a technical writer, and I can take the step back as the person seeing this stuff online. If you want to just have another set of eyes, I'll gladly.
Well, I think I really because we're really just explaining what food safety inspections are, why we do them, and then the reports. We're really not posting anything more than that.
Okay. Yeah. I just wanted to make that offer.
Thank you.
Okay.
Thank you very much. Thank you, Erin. Okay. We'll move on. Meet the minutes from the meeting in August 21st. Have you looked them over?
Yes.
Any corrections?
No.
Do we have a motion to accept them?
Accept the minutes. Second that motion.
Second. All in favor? Linehan. Aye. Silver, aye. So moved. Is the variance request you want to do?
Actually, could I ask if we take something out of order? We're going to have the health director's report include Liz Larson's introduction.
Okay.
The floor is yours.
We'll take the health director's report out and first move that up.
Thank you. And thank you, Anthony, for allowing me to speak tonight, and to all of you. My name is Liz Parsons. I'm a new Prevention, Outreach, and Youth Services Manager for the town of Wakefield. I know I've met a couple of you. Looking forward to meeting you, Mary. I have started in July. I come with almost 20 years of youth substance use prevention experience in Massachusetts, and including positive youth development experience. And my particular expertise is in alcohol policies that help support communities and states move towards effective solutions to prevent alcohol harm. So what I've been doing the past 3 months, and what I'll continue to do, is just meet with several community stakeholders, both in the town and in the school and throughout the community. I've convened the Wake Up Coalition meetings and also have overseen the Youth Action Team, which is the youth coalition part of the community coalition, because we're looking to hire for a vacant position, the prevention and wellness coordinator position. So, we've had some funding changes and fundings that has come to an end. So we're looking for more, and we're also working toward policy solutions. So I look forward to working with all of you, and one-on-one and as a group. Great. Thank you for coming.
Thank you, Liz. Nice to see you.
If someone were interested in that position, where would they find that posted?
It's posted on the town website.
On the town website. Okay. Thank you.
You're welcome.
Welcome. It's nice to work with you again, Liz. Before. Nice to have you. Anything else?
Yeah, we're excited to have Liz on board. There are a lot of things that we're interested in tackling, alcohol policy being one of them. We've talked a lot about one-day permits, one-day permits, temporary permits, and general alcohol policy here in Wakefield. So that'll be one of our priorities.
there anything else you have in the health director's report, Anthony, that you would like to do now?
Nothing of note. The only thing was I was going to include just the nurse's report. Nothing of note except there's an uptick in peripertussis, which I learned recently is actually a less severe form and less infectious form of pertussis. That's been going around in the schools. We've seen kind of a lower vaccination rate for that for students entering this year. So we're kind of working with the schools to see how we can do contact tracing, figure out how to give them resources, but also kind of work with families to talk about how important immunization is. We're already seeing kind of a shortage of staff. So having staff and students at risk of being out is difficult. So we're going to be working more closely with our schools to kind of figure out how we can address that forward.
Is it not required vaccine?
It is, it's required.
I believe it is.
It's required before and then once in 7th grade. But the reason, the history with pertussis was that you got it young as an infant, and then we had a huge outbreak a few years ago. And what happened was we saw the difference. The data showed us that it kind of weaned off a bit when you got to 5th and 6th grade. That was when some of you here probably remember when you were like in band or color guard or something like that. Everybody got whooping cough, and that's where it was. So what they do is they put that in another mandate in. But now there's a lot with COVID, tons of children way behind in COVID. There was a lot of skepticism about the Tdap many years ago, that it was a problem with autism, and that was proved wrong. So we had a big outbreak through California. And now Tdap is, or the pertussis vaccine is now mandated for new mothers each time. For dads, once every 5 years, and grandparents should also have it. Because you can have pertussis, that little cough sometimes is not really relevant to you, and it can just spread in infants under, what is their first Tdap? DTaP is 3 months, am I right? 2, I think. 2 months. So for the first couple of months of their life, they're very vulnerable, and that was what was happening. Very, very much so.
I have a question. You mentioned being behind on COVID vaccines. I have been alarmed over the past month about the number of young students dying in the fields. And in Massachusetts alone, there's been 3 within just over a month. One in Brockton that was 11 years old, one in Peabody that was 17 years old, and one in Framingham that was 18 years old. And I know it's a very controversial issue, but as long as we're talking about extreme outcomes, which I think death is pretty extreme, it's a concern. And when we talk about, there might be a couple of cases of EEE in Western Mass or Northwestern Mass, I think this is a little more concerning. And I know that there was a recent study out of Oxford University with 17,000 participants where they noted that myocarditis and pericarditis was only found in the vaccinated students in that group, not the unvaccinated. So I can share that with you if you'd like to have it. It's a little bit of a concern. We don't see young people dying of COVID. So I don't see the need to talk about vaccinating young students for COVID. But we can, certainly.
We were referring to the Tdap for the pertussis, but
I know, but
I understand
about COVID.
There are children, a lot of children since COVID are way behind in the normal routine mandated vaccines. Okay. This particular thing you're talking about, the COVID, they haven't found a direct connection between the vaccinated and people who have had it, but they are doing data and also collecting them, and not correct on adults, am I right, Anthony? On that, but there's nothing out completely yet.
Well, this Oxford University study was fairly recent. I think it just concluded in maybe even in October, and it was quite concerning.
Well, I think we have to wait till the CDC and DPH probably adopts it. They'll probably look into it. I know that the American Public Health Conference is the end of this month, and there's also a pediatric conference and a school nurse conference going on. maybe we can find out from someone who's attending. I will be on APHA online here. I will not be in person. I will be here online. And I haven't seen that mentioned in any of the programs, but I'll go back and look specifically to see if I see something like that. And maybe we could, I could send you the vaccine unit. Maybe you could have Melissa give me a call and we can talk and ask.
I'm happy to send you the link, because if we're going to be in front of people getting bit by mosquitoes, we should definitely be in front of young people dying on sports fields, I think.
Was this in a medical journal? I'm sorry.
Oxford University did a study.
Oxford, but like, was this research published in a medical journal?
It's recent, so I don't know where it's published, but it's recent, yeah.
If you could send us the link.
I'll send you the link. Yeah,
sure.
And have Anthony take a peek at that.
Yeah.
Do we have an epi yet?
On staff right now. I think it's
just plenty of epis. We could turn it over. We can ask us and request it. If you send that to the Board of Health, send it to all of us. I'll send it forward to the epis at the state that we deal with. See what they have to say.
I mean, when you're dealing with children, you have to err on the side of caution.
I understand, and I think I personally have not seen the study from Oxford. I think I'd be interested in reading about it.
I'll send it
I haven't yet found an article or a study that has conclusively linked COVID vaccine and myocarditis and death in children. I know the study is probably talking about an association. They're looking for if there's a connection between the two. I haven't read it yet, but I have not yet come across a study that links those two things. So I think for us to kind of make that determination, especially at a Board of Health meeting, would be really difficult to.
Oh, I'm not trying to make the determination. I'm trying to bring it to your attention, because we had 3 students die in Massachusetts in a month's time, on a sports field. That's pretty alarming.
And I don't know for sure. I have to read the study, but I don't know that the only common denominator between those 3 students would be if they had the COVID vaccine, right? So I think
of course, and I agree.
Right, so making that link would be, I think, difficult in this public forum, but again, happy to look at those studies and kind of figure out what's next.
I'll send it out.
Thank you very much. Is there anything else in your report?
Sorry, did you have
There's just one more. When's the next flu clinic? Just so
the next flu clinic is this Saturday at the Civic Center.
26, right?
It's like 10 days from now.
Oh, sorry, next Saturday, flu clinic. It is from 9 to 1 p.m. We'll be
supposed to be away.
So we'll be at the Civic Center. We are looking for additional vaccinators. So I think we have 3. So I think you, Melissa, and Sandy are doing it. So we'll just need 1 additional person.
I'll see if I can swing. I'm not going to be in Minneapolis.
We don't have to. I mean, it's not going to be a huge turnout. I mean, in terms of like a huge crush. So I think 3 would be fine. But
is that clinic open just to Wakefield, or is it also open to the whole coalition?
No, just like any other clinic, we open to anybody who wants to come. Yeah.
We're starting the next 5 or 6 Tuesdays, 9 to 12 in the office walk-ins.
Yes.
Walk-ins.
Anybody can just walk in.
Yeah. So that's the only other announcement. I guess the only other thing was last time we didn't have a meeting. Thank you to the board for being flexible about that. We just happened to have a coincide with a recovery event. It went very, very well. Elaine was able to make it, but the recovery event happened down by the bandstand, not gazebo, bandstand. It was a great event. You know, we had a lot of supporters, lots of recovery organizations were there. We had a couple of really brave folks step up talking about their lived experience and how difficult it is. Jason, our social services coordinator, did a great job emceeing the event. Liz, thank you for helping with a lot of the setup as well. But just a great night bringing everybody together to raise awareness around recovery.
Thank you. It was very, very nice. It was a very nice event. Very well attended too. It was very well attended. Okay, next thing on our agenda is your variance request for the mop sink at the branch.
Yes. Actually, there's one. Sorry, one second. There's one simpler. Could we take Stedman Ave out of order?
Yep, Stedman Street.
Yeah. So it's chicken variance. Wonder if that's okay.
That's down on the bottom. A very request at the 20 Stedman. That's the chickens.
Yes.
Okay. Okay.
Okay. I'm Shauna Bell, the 20 Stedman Street. I have, hopefully, if you have access to the online file, it's been updated with the 6 abutters certified letters. Yeah. Yep, so you've got that picture. So I think what is requesting here, the variance, because I can get to, instead of the 50 feet, I can get to about 39 in the back of our yard. It's a 6-foot fence. And what is unique about our property is where I'll have this coop, we have an abandoned woodlot, right? So there are no houses in there. So on that other side, you're down, and it is probably, it's hundreds and hundreds of feet to the next house. For the other abutters, they are down. So it's probably a good 200 feet to other houses. I've got pictures that I put in the file to show just how kind of either trees, bushes, separating here. This coop is different, I think, from most chicken coops. So I don't know if you've seen this yet, if anyone in town has them, but it's a relatively expensive omelet chicken coop. So it's from UK design, it's polyethylene. You've seen these are great for backyard. Yes, and what's unique about them, because it's plastic, you can pull out the trays and clean it. So it doesn't absorb that chicken smell when things get hot. So this is about as clean of an operation as you can possibly get. So this is, they're cleaned weekly. We've got the black earth compost. So that is where all the pine shavings go. Anything just gets composted. I think what else I can tell you, the neighbors are aware of this. I'm assuming you haven't received, I sent a letter out, no one's called with any questions or concerns. You'd have the opportunity to talk to me, raise it as well. What else can I tell you?
This is really just about the distance from the home.
Yeah.
But just a 139 versus 50.
Yeah, so 39 is where the coop would be, but if the regulations say 50, you're also going to get a variance.
So the variance would be to allow for a shorter setback distance than.
And I'm hearing abutters are, everybody's on board.
We've, unless I'm incorrect, I believe we've received all the letters and we haven't received any opposition from the abutters about this. All right. Yep, go ahead.
Aaron?
Oh, I was gonna just mention rodent control and chicken wire.
Yep, so it's a fenced in run that actually is what the omelet does too, it kicks out, so it prevents the rodents from coming in.
Okay, so it's underneath, perfect, okay.
It's actually where we have this in the backyard too, like I know coyotes are everywhere in Wakefield, but this is house with a 6-foot fence. They also, there's an auto door, so they get locked in at night, so they're very smart. Go in there, they're in their coop. If you go on the website, you'll see there's pictures of mountain lions in California standing on the top of this thing. They can't get in, so it's predator proof. It's good as a design as you can possibly get.
Do you have to dig down below it too, or not? Just
no, so where this is too, like, so anything coming, if it's coming from the woodlot, would have to go through stone and rocks to get under the fence. Okay. But it's metal fencing that goes down and you basically screws from the ground.
It's like, the way we used to say is to have to dig down in the coops and stuff like that. You have to be new ones up.
Yeah, so it's advertised as predator proof. We haven't had issues.
Yeah, and I think there's 1 or 2 people with them in Melrose, because I don't do the chicken coop inspections in Wakefield, but I do them in Melrose. But someone else does them in Wakefield. But that's one thing we look for is the that it's predator proof, and she's right, these are very easy to clean, which really helps with maintaining the coop.
Yeah, they're designed for these smaller spaces.
This is your first time having chickens?
I actually grew up with chickens, so I did this when I was 12 and kept them alive. So at 46 and being a little more financially secure, I feel pretty confident I can handle this.
Okay. You're gonna have 6?
Probably 8.
8?
Yeah.
Even number, not the odd?
Yeah, we had 8 names picked out, so.
I've always heard about how you had to have odd because of the pecking order.
Nobody's killed anybody. Yeah, they all get along. They're a lovely group of ladies. Cool. And they're all vaccinated, so we've addressed everything, I think.
I'd be inclined.
You want to make a motion? Go ahead.
I'd make a motion to grant the variance for 27. I second the motion.
All in favor?
Linehan, aye.
Aye. Silver eye, so granted. You have your variance.
Thank you so much.
Thank you.
Yeah. All right.
Hope it's a warm winter for you.
Are the eggs super insulated? What's up?
Are the eggs all hatched?
Oh yeah. So this is for egg laying. I have a 15-year-old who's obsessed with baking, and we were blowing through 2 dozen eggs a week. So this is I'll offset that a little bit. Yep.
Oh, good.
Cool. All right. Thank you so much.
Yeah, you're welcome.
All right. We may be by someday to see it.
I'd love to. I'd love to check it out.
Check them and see
Yeah, it
them.
sounds cool.
Yeah,
Please do.
Just thank you. Just to clarify, do Do we have anybody here for Broadway for the
No.
chicken variants? No. So do we want to just?
If there's no one here, no.
Yeah. Do we want to just table Broadway, Erin? Is that okay?
Yeah.
Yeah. Okay. So we'll
Yeah, I would table it if none of the parties are here.
All right, that's okay.
They requested next month.
Okay, so we'll put it back on next month.
You want to go back to the mop sinks, or did you want to go to the pigeons while you're on birds?
Who's here to talk business?
Yeah.
Anybody here to talk
Is
business?
Is there anyone there for the mop sinks?
Yes.
Mopping, yeah.
Would you be
So
okay?
let's do the
Would you be
mopping.
okay doing the mopping? Yeah.
Let's go right ahead. So let's do the variance request for the mop sink at the branch.
Did we get a form that was filled out? Did anyone return that?
Yep.
Okay, great.
There's pictures here. I can leave with you and you can let me know what you think. So the problem was the height of the mop sink.
Could you state your name and?
I'm sorry.
Yeah.
First name Keith, last name Brennan. I opened a pizza place at 1117 Main Street. As they came in, they told me my mop sink height was too high, so we lowered it and we have pictures and permits.
Was that mop sink, that height, was that in the original planning, Erin, do you know?
I'm not sure. I couldn't really find a plan review on file, but the reason, well, there's a few reasons why it's supposed to be on the floor. It's so that water can't splash into, food prep areas. But so I'll like do the variance request for you, I guess. The mop sink is already in a closet, like next to the water heater. So it's pretty far away from food prep. So I would say the floor issue is not a huge deal. It's more for the person, lifting the mop bucket. And just a caveat that toilets are not allowed to be used to dispose of the mop water because you can contaminate the bucket and splash water. So right now they kind of have like a slop sink, like those big plastic sinks next to the water heater, and they're using that as like their mop sink, which I said was okay, but they need to request a variance for it being on the floor with new ownership.
Okay, I think prior to him coming in, wasn't there also a food establishment in that building? Am I correct? Another pizza place?
There was, yeah, it was still a pizza place. I don't know why I don't know if this process was done before. We didn't have anything on file, but so I don't know when this sink went in, but it doesn't meet the food code right now, which is why we asked the new owner to do a variance request.
I believe that sink was put in, I'm going back probably, I hate to say it, back to the early 2000s when there was a convenience/deli contestant there. And he was the original one that opened up anything food. So it probably was put in there. And we probably granted them variance way back in like 2004, 2005.
Okay, yeah, maybe. I couldn't find anything in the file, but so I figured we would just.
Specifically to have the sink in the closet? What's the variance?
No, the variance is for the sink height, so it's not on the ground, it's lifted up.
So it's okay that it's lifted up, ideally, because it's away from food.
Yeah.
Okay.
Yeah, so they want to have it to meet right into the code.
Yeah.
So
Yes, because I would worry about it. Well, the public health rationale from the food code is that it could splash. Yes, exactly. Yeah.
Thank you for your patience.
Thank you. Do you have any, are you the owner, Mr. Brennan?
Yes.
Yeah. Do you have any comments or any questions?
I don't know, I have pictures here of what we did. So the problem was the height. We've lowered it now to the floor.
Okay.
That's what I was asked to do, so we did it. The permit
So do we
here.
still even need a variance, or is it?
Oh wait, you did.
You already lowered it?
Yes.
Oh.
Yeah.
Huh?
Permits here. It was inspected.
Oh, so you did lower it. So I guess
So
if
we don't need a
it's
variance.
So we don't need a variance?
yeah, if it's on if it's on the floor, then it wouldn't.
You have the pictures? Could we see the pictures, please?
Yeah, let's see what this looks. I haven't seen this.
Seen them? I was going to say. So this.
So that's on the floor. So this white one is the
This
one
one
that you
is
guys put on the
the
floor?
new
Yeah, the original one there was probably about maybe 32 inches high. That was the problem.
32.
So it's in the same place, just,
Identical spot lowered on the floor.
all right.
Oh, then yeah, I'm not sure you would actually need a variance then.
Do people need to come back out and see it?
Erin, do you guys need to go
Yeah,
back?
I can go by tomorrow and just look at it.
Yeah, if you wanna go back and take a look at it?
Mom and Inspector's also been there already too, but
Yeah.
whatever works.
Well, the permit was pulled, was inspected and signed off by plumbing and gas. But that's just the permit.
Yeah, and we didn't hold up their permit or them opening because of this issue, because this wasn't big enough to hold up anything.
So Erin will go by and take a look at that.
That's fine. Yeah, that's fine.
So we don't have to, you don't need the variance, then you'll be okay. And one of the inspectors will be by anyways, just to get their eyes on it and put their own little notes in it, make sure that everything's okay.
Excellent.
Okay, thank you very much for coming.
Thank you for your time.
Yeah, thank you, Mr. Brennan.
See you tomorrow, hopefully. Those are few, I have my own. Thank you.
All right, we're gonna go for the variance on the mop sink for Dino's. Is there anyone here for that?
For Dino's, it looks like there's no one here, so
no one here,
we're
so
gonna
table
ask if we
that?
could table that. Erin, is that okay?
Yeah, that's fine.
So let's see.
Oh, we're gonna go to.
He is also Keith from Tree Room.
That's, yeah, I have him at my house.
Same person. Oh, yeah.
The branch.
She's kind of a celebrity. Yeah.
Oh.
Did you know that was why they named it that?
No, that's awesome. We gotta get you out. My kids do dance next to it, and I've been sitting in that parking lot like, why'd they call it that? Oh my gosh.
Oh yeah, he has his mother-in-law running it, and it's really nice in there. Yeah, it's great.
That's cool. All right, a lot of good comments about it.
Yeah.
All right,
Yeah, exactly. And it's like everything was new already. It was recently replaced and stuff. So the kitchen's very nice.
That's great. An overhaul on that. We'll go down now on the agenda to 62 Old Nahat Road on the pigeon permit. Is there anybody here for that? Okay, can you state your name and your address, sir, and let us know?
My name is Bernardo. I'm from 62 Old Nahat Road. I come here for the apply permit for the pigeon coop. I have 7 pair in the coop. I don't let them out. They stay in the coop, and I come out to look at them and feed the food to them, and I clean up every 2 or 3 days with a big construction vacuum, like clean and this is my hobby and my childhood hobby. So that's why I clean up everything. I put the food in the feed metal, but the food before I feed to them, I put in the big can, big metal barrel, and I keep clean up, and even now I want to make sure, like when I step outside of the coop, I have the vacuum. I make sure everything clean up, but I'm sure there's no food drop out of the coop.
How long have you had the pigeons? If you've done them before, am I correct? Or is this your first time? Is this the first time?
Yeah, this
the first time to get the permit?
Yeah. Actually, I didn't know I had to apply the permit for the pigeon coop, and today I come here. I want to apply for the permit, and hopefully I can get approved, and I can keep my.
All the abutters have been notified.
So we did get notification from all the abutters that they have signed off. There was a little bit of a misunderstanding. There were some RAP issues, but it seems like they've cleared that up with them, and he's already kind of elaborated on the steps he's taking to prevent that. Sounds like he's doing some cleaning of shoes before he comes in and out of the coop. The food's kept in a very secure location. Aaron, I don't know if I missed anything, but it sounds like that's the information we were provided.
The coop is predator proof.
Yeah, I assume that the coop is safe from predators.
Yes.
We have very few pigeons.
Yeah, I was gonna say the coop, did you build it yourself or?
Actually, I and my brother here construction, he built the coop like a shed because I told him I don't let my pigeon out because I don't want I do not do I don't let them out for the fly because I don't want they stay on the roof of the neighbor house. So that's why I asked my brother build the shade like keep warm and good, keep it clean and easy for me to clean like 2 or 3 days. And when I come out, I look at them, I enjoy the tea, look at them when I have free time or when I get home. Because my hobby with my father when I was in Vietnam around 8 years. So when I come here and I bought a house here in Wakefield, I see I have the big land, so big backyard. I asked my brother to do that because I live with my mom and I want when I have free time I come out to enjoy my hobby like that.
My grandfather had pigeons on the top of his bakery roof. I only went up there maybe 4 or 5 times. I wasn't allowed up there. I used to go down to the bakery pot and help make bread. I like that much better. Yeah. But I never knew why they had them or what, but they were up there all the time. He used to go up there and talk to them. I remember that.
Yeah, I love when my wife got home, she spent time with my little boy 3 years old. So I have my time. I go out to.
How many? What's the limit?
Yeah,
what's
7.
the limit? 7 pairs?
Yeah,
is that what the limit is on our permit, or do we have no number?
Either, Aaron, I think it's 7 or 8 pairs. I believe, is that right?
7 or 8 pairs of pigeons.
Yes, that's the limit. Yeah. I believe that.
I was gonna say something like 10 or 12. I remember that number. Yeah. Am I wrong?
I believe the number of pairs is within our regulation.
I don't know. I remember discussing it, but I don't remember where we landed on.
Is our ask tonight to approve a permit?
Yeah, he didn't know you needed
So because he already has the animals.
Yeah.
No, I think it was just like a license violation. We were just I guess asking the board if he can continue, if he can be granted a permit moving forward.
Yeah, so this was due to a dispute over rats and issues with the abutters, but that has since been cleared up and the abutters have signed off on. So this is
But I think we still have setbacks, so that has to be approved.
yes.
Yeah, and not knowing a permit's needed is a pretty, I mean, it's pretty common when it comes to keeping of animals. A lot of people just don't know that we have regulations for it.
Yeah.
So the ask of us is to grant a permit?
Yeah.
Yes.
Yes.
Okay, very good.
Okay. Any discussion or anything, or any questions for him? You want to make a motion?
I would move to grant the permit to keep pigeons for 62 Old Nahat Road.
I second the motion.
All in favor?
Linehan, aye.
And Silver, aye. So moved. You have a permit now for pigeons.
Well, he's gonna apply.
He's got to apply. We got to apply.
Please apply.
We're saying you if you can apply for the permit.
Please
So
apply. Yeah.
fill out the paperwork and give it to Cindy, and then he has to go for a variance.
That's right. And the limit for pigeons is 7 pairs.
7 pairs. Wow.
So
we're there.
So you are at the limit. So please no more pigeons.
That's it.
So then he'll apply,
And then,
and once we have everything in, he may still need the variance for the setback.
Oh, okay. He's gonna have a setback there. Okay.
Okay.
All right. Sounds
All right.
good.
so, yeah, so please apply
Yeah.
for a permit and then we'll go from there.
Small animal farm in my backyard.
So you're almost there. Bring in your.
Everything that you can
So
imagine comes to visit.
I have to come back to talk to you about this.
Bring me all the paperwork, the letters. I think that was the only thing I was waiting for.
I already give the letter.
Does he already have it?
Oh, you know what?
I give the
Oh, the
letter
butters,
to
Dan, you gave him to Dan?
Yeah.
Okay. Okay, so then,
yeah.
should be all right then. I'll look tomorrow.
Okay.
They're good.
Yeah.
Thank you very much for
Thank you.
coming tonight.
Good luck.
Thank you very much. Thank you.
Okay, take care.
We have
I just came to these.
dumpster regulations are next on the agenda.
Yes, so Aaron, we're gonna be talking about dumpster regulations, I believe. We might have discovered a discrepancy. So we discussed dumpster regulations quite a while ago. I think this is to do with temporary dumpsters. And so we had a 45-day limit for temporary dumpsters. We had a limit of 2 temporary dumpster permits per year. This is to avoid like the use of properties as contracting properties when it's not zoned for that. I believe we just found a discrepancy in the application for it was 90 days, even though our regulation said 45 days.
Opposite.
I had it backwards. 90 was the regulation, but 45 was the intention, and that was in the application. So we are asking the board if we can discuss tonight, potentially vote on adjusting the regulation to meet the intention on the application, which is 45 days instead of a 90-day granted permit. 90 days, if that's renewed twice, that's basically half the year. So we're looking to lower it from 90 to 45 days.
How many temporary permits do you get?
A lot.
Do you get a lot?
Like
Yeah.
home improvement type stuff.
Home improvement, minor renovations. And
What about those bags, those giant bags when people are doing?
Oh, like those toter.
Personal.
Yeah,
cleanup?
we permit those the same, well, the bagsters, yeah, we usually permit those the same as a dumpster.
So only twice a year and only for.
Yeah, actually, no, I think the bagsters, if it's through like a place where you just like have it, you call a number once it's full and someone picks it up, I don't think we regulate those really.
No.
I don't think we
What's
really.
So what do you, there are like really big bags that you do regulate?
Just dumpsters.
Just like
Yeah, I think it's actually just the dumpsters. Yeah, because yeah, I just don't think we really have a handle on the bagsters.
Bagsters aren't super common. If someone does see them and they reach out to us, I guess we can take a look and see if it's really causing an issue. But you know, they're not meant to be permanent.
Yeah,
So
most of them
Yeah,
are-
we usually just treat it like a short-term dumpster, as
Yes.
when we regulate it.
What is the
We don't-
difference
no,
in
we don't
price
permit
of, may I ask you about the temporary dumpster versus a dumpster for a year or something like that? What is the difference in prices?
So for a temporary dumpster, it's good for 45 days, it's $40 with the ability to renew it twice for $15 for 2 weeks. So they can 2 times.
We could get up
renew
to
it.
65 days
Right.
on a permit,
Right.
possibly.
So and then a permanent annual dumpster for just say a 2-yarder, which so we, as you remember back, I think it was March of 23, we changed our fees. And this is when we did this, but didn't change in the regulations. So annual dumpster fees are depending on the size of the dumpster. So like a 2-yarder a restaurant may have, it's $100. $50.
So Cindy, are we allowing, is it gonna be 45 days and then 2 14-day renewals?
That's what we say
Yes.
on the fee schedule.
Okay, so a total of 73 days.
Yes.
45 and 15, yeah, correct.
Yeah, so 45 and then 28, yeah. Okay.
If they had it for the extra 2 weeks, they wouldn't have to pay the extra $30 if it was not changed. Because you were saying 2-week extensions are $15 each?
Yes.
That's correct.
Yeah, that's what we currently do.
Want to extend them if they're in a renovation, they want the renovation too.
Yeah.
Yeah, but if they're held up, right? Like,
They're held up,
correct,
yeah.
It's the
Yeah.
contractors that are doing the work, so that I guess it could happen. But
A lot,
No, I'm sure it
yeah,
does,
a
yeah.
lot of cities and towns will do a temporary for like 30 days or 60 days and they can renew it again like every month. But then what happens if you have someone who the renovations, especially how high is, you know, how like the insurance companies, the darn thing, they're renewing it costs them more, and they would have been better off to get a permanent, like for a whole year. Yeah, instead of that.
Yeah.
6 months or something.
Is that allowable in a residential setting?
Yeah.
To get a permanent?
Yes.
Yeah, it is.
That's most
For a
of my
year,
temporary
yeah, for a year.
dumpsters.
Yeah,
are
and
for-
people could do that instead of getting the town trash, especially like with multi-families, sometimes. they
Oh,
get-
you were asking
No.
on permanent, right?
Correct, so you can't do that.
No.
You have to, you would be a renovation situation
Yes,
or a
yes.
fire,
Yeah.
perhaps.
Yeah, that's the
that
only
type of
time you'll
thing.
see a big dumpster like that
Yes,
for a
yes.
long, long time.
Yeah.
Yeah,
Yeah.
but I think we're just asking tonight, right, to just make the dumpster regulations follow along with the fee schedule.
Right, yeah, so it does, yeah. Somebody want to make a motion on that? Is there any discussion? Anybody have any other questions or anything about it, or, I mean, is there any reason we wouldn't do this?
I'm not particularly in favor of penalizing someone if their renovation is running along. If they're paying $15, they're probably, you know, it's already frustrating.
Yeah, I get that.
Well, I think.
Yeah, maybe
most-
that could be tabled for a different.
Yeah, we could when we, do we look over again the fees? Do we have those again on to look on that?
We could take a look.
Yeah, this is more of just a housekeeping, right? It's like.
Yeah,
just-
let's get this just so it coincides with it, and we can table the fee schedule again, maybe we can look at that again.
Well, it sounds like the fee schedule is set, no?
So the fee schedule, we renovated all our fees back in March, I think it was March of 2023.
Correct, yes.
So, temporary dumpsters in the past it was good for 90 days, it was $40.
So why do
Now-
we feel the need to change that?
I forget why we changed it, but we changed it.
I think we might have changed it. I think it wasn't the majority of cases, but I believe there were a couple of cases of people kind of exploiting that and getting temporary dumpsters and using their properties for contracting purposes. We didn't run into a whole lot of like home renovation at the time, home renovations that were, you know, causing issues. Those are generally pretty quick, but they would get move on.
Well, yes and no. We see
Well,
some, like you said, that go
right.
on.
Some do go on, but I think the
Yeah.
reason we changed it was because of the exploitation of temporary dumpsters being 90 days and a renewal, and then that would have been 180. I think there was still an
We had
option to extend
someone-
the 15 days.
Yeah, we had someone had one, a dumpster for like over a year.
Yeah, but that's a whole different issue.
That's a whole
Yeah,
other
you-
thing.
Yeah, you said that's the exception, not the rule.
Well,
Right.
and a lot of this, like a lot of the dumpster compliance is really just complaint based anyway, you know?
Right, we don't-
We're not policing short-term dumpsters.
And what I could do too is I can even run a report, like I think most of the time when people apply for a temporary site, they have it for 2 weeks. They have it for a month,
Yeah.
you know, so.
Yeah, or they get a building permit and that triggers the, you know, need for a short-term dumpster.
I think it's up to the board if it gets to a point where, like, you know, if we have the 45 days, if it gets to a point where it's like, it's causing an issue, like, let's just say a couple home renovations are like going over and.
Yeah, with-
And then we can always.
So this 45-day change still would allow for those extensions, right? That's still part of it.
Correct.
We're not
Okay.
talking about it.
At a fee.
But
Our fee,
the
yeah.
extension will come with a fee, right?
Yeah, okay. A $15 fee.
Yep.
And additional responsibility of going down to do an extension.
It is just do it online,
You
just
do it
renew
all
it.
online, and mostly that's your contractors too, especially if you're doing a house, will be a contractor that will do it,
That's a
or the
good point.
dumpster company that will do
And
it.
they should know the time.
Yeah, they're pretty good. Okay.
So, we can evaluate the fee schedule as well. If that's something the board wants to take a look
Because
at.
this is really about the amount of days
Yeah.
the permit is valid.
Yeah.
So we're just trying to make it,
Yeah, this is really just so our fee schedule says the same thing as our regulations. We just need everything to match.
yes, okay.
Right, and then
Or
if we,
conversely, you could change the days back to 90 versus 45.
The board can do whatever they.
Yes, the board did that too, yeah.
I mean, how long was it like that, Cindy? Do you know?
Oh, for, at least as long as I've known, so 12 years, that it probably before me. And I think what we did do is when we decided to change fees, we met with we researched what other towns did. And I think we saw that other towns did the 45 days. So we were like, oh, that's probably better. And I think that's another reason why now I'm remembering, is why we decided to change it. But
should the board decide to do 90,
right,
that's fine too. That's well within the scope of the board's decision.
So, we have a comment. Do we want to just approve to make it the same, the regulation and the and make the regulation and the application the same amount of days, and just keep the fees we've already got in place? Am I correct?
Right now,
the regulations we have for now, and then just take a look at it maybe again in 6 months or a year and see how it's doing.
Okay, so what you would want to do now is either accept the change in making it match what the fees are right now,
which would be reduce the amount of days to 45.
Correct, because the regulations right now say 90 days, what it had been for.
90 years probably.
Marcy, is the thing that gives you pause the additional fees to extend? Or is it the change in days? Is it like the additional money and the extra work of applying again? Or do you have a feeling about 45 versus 90 days? I don't think anybody wants a dumpster longer than they need it. It's always an inconvenience. Well, and then I wouldn't. I mean, if you were the contractor and you thought, I'm going to go to this job and bring this job stuff over and put it in this job stuff, then yes. But most homeowners don't want that. And most anything that's charged to a contractor gets passed on to the homeowner. So you're looking at like $40 and then $30 if it goes to the 90 days, right? So that's that's almost 100% increase in fees over what it was. Not quite, 75% increase in fees. Seems excessive to me.
So am I hearing that your issue is with the fees, not really with the days?
Correct. Okay. Correct. I mean, I don't know if we can change the fee schedule. You said we can do whatever we want. It sounds like you've already put it in place, but perhaps the fees are something we were going to talk about another time. Today, maybe we'll just.
We wouldn't change the fee.
Yeah. See,
no, the fee's not going to change.
Yeah.
Because if you wanted to keep it to the 90 days, we could consider going back to what we had it, because that's what the regulations say right now anyways. And that's a simple change in the online portal. But if somebody got a dumpster for a temporary dumpster, the way we used to do it, it was good for 90 days and it was $40.
Okay, so basically to clear it up is if we're keeping it at 90 days, then it won't require a vote tonight, and we'll just update the fee schedule to match it and say 90 days for whatever amount we were charging before. If we were interested in moving from 90 to 45, that would require a vote tonight. So that's the two options right now, I guess, feasibly, is if we keep it at 90, no votes required, we move it to 45, then we wouldn't need a vote.
And you're remembering that when you looked into this before, it seemed like other towns were using the 45 days.
When we looked at surrounding towns, generally it was around 45 days.
Most use 30.
But it's not really abused, you said. It's the exception, not the rule.
It hasn't been really, I mean, I don't think we've got a lot of complaints there.
I'm just not in favor of passing more fees onto, it's going to go from the contractor.
Sure, yeah.
You know.
Let me ask you this, when a homeowner calls a dumpster company, like a local one, to come to put a dumpster and say cleaning out their home or something, what is the fee then? Is it a temporary one? Okay, so, and they usually put that right in the whole rental. I know that, I've seen that.
They get a temporary dumpster for
so many.
They
usually tell you 2 weeks. Yeah, well, it keeps you on your toes to clean. That's, let me tell you, you don't want to do anything
Just
more.
hoping for the best. Right?
Yeah, because it's a good amount of money to get that dumpster. You know.
I've had one person ask me to extend it since we did that. So since we're, 2 years now. Oh no, March of 23.
23 years.
And we had one extension.
Oh, that's not bad.
Beyond 45.
Beyond 45. All right, any thoughts? Does anybody want to make some? Do you want to change or just keep it to?
I mean, I think there's something to be said for being consistent with our neighbors. But I think it'd be interesting to know what's really happening, but I like how long are people actually keeping their dumpsters? I mean, I don't even know if that's information we could get. I also don't feel like wasting the board's time digging too far into this.
Well, you're right. I mean, we have the information how long to keep the dumpsters also.
I mean, they when they apply, they usually say, it's going to be 10 days, it's going to be 2
Right.
weeks, it's going to be 30 days.
Yeah.
Whether, you know, we're not really watching.
Yeah.
So do people even need it?
Well, they want them back too, right?
Right.
Place them somewhere
Right.
else, yeah.
Right. I mean, like, is 90 days just excessive? Is it not even what the town people need?
It sounds like so far most of our requests have been under 40.
I can run a report.
But
Yeah, I was gonna say, I think in Stoneham we do 45 days too.
I would keep it.
Yeah, I would say most people don't have it longer than 45.
I don't really have huge feelings on this. I don't really have huge feelings.
And the thing is, like, if they
Yeah, I was gonna, it's not something to have
Yeah.
a lot of feelings about. It's just how, yeah.
I mean, and honestly, like, I think if somebody said, if someone said, I need it for another couple of days, I'm not, you know, I'm probably not saying you need to reapply.
Yeah.
Oh, they're picking it up this weekend, is that okay?
You're not gonna send the dumpster police?
No.
No. It's not like,
No.
No, we don't, we no.
There's no time.
And we would only inspect or like put eyes on a dumpster if we got a complaint about it.
Right. It's true. The only time you ever know they're there.
And what is a complaint? Like, what do people say?
Trash, smell,
animals.
No, it's overflowing. People are putting food in it. There's rats. The plug is gone, so it's, you know.
catches on
Yeah.
fire. Yeah, all that
Catches
stuff.
on
Yeah.
fire.
I've seen that.
Yeah, or if it's not, if there's no plug in it and it's not on concrete, if someone put it on grass, not a great idea. It should be on concrete, so it's, you know.
Okay.
Yeah. That's it.
I mean, I'm okay with the consistency, putting it at 45.
Yeah.
If it feels like it makes things easier, and if it's consistent with our neighbors, and
It's easy for contractors too, and for people.
yeah, people working in different towns, they'll be able to know what the
They'll
rules
know
are.
what it is, yeah. You?
I'm a no, fees tend to creep, so I don't like the added fees, but I mean, it's not, I guess it's not the end of the world, it's a dumpster, you know?
Well, maybe just keep track of it and see how many times we really truly get something, and if you think there's an increase and you see a change or something, Cindy, you could let us know and bring it to us so we can take a.
I'm just trying to think of the way to do it without a fee, but.
Yeah.
I'm noticing a lot of pretty big renovations, like second floors and complete, like, what do you call it, when you completely gut a house?
Yeah.
I would think you would need that dumpster for a little bit of time, you know?
Depends, they're fast.
Yeah, I think they empty the big stuff out and they get to work inside, right?
They may come back in a couple of days, a lot of them just come to these, if you, depending on the size, if you order the right size, you'll be okay, you'll fill it up once and that's it. And some of them, if they have to come back, they charge you, so let me tell you, you make sure you get that dumpster and it's filled to the brim.
When we did a run out, we just had like one pile of stuff and a truck came and got it once.
Yeah.
We didn't even have to like load the dumpster.
Yeah,
They just
sometimes you
got it.
don't, so. I guess we'll just keep it.
Wait, do we need to make a vote then?
Okay,
I'm
so are we keeping it at 90 or moving it to 45? What do we?
45.
Okay, so if we're doing 45, then this would require them, yes.
So it's, I'd make a motion to make the fee schedule and the regulations consistent by adjusting the number of days on the fee schedule.
No, on the regulation.
On the regulation schedule to 45, to be consistent with the fee schedule.
Yes.
I don't know.
No, I'm going with the yes.
Okay.
Linehan, yes.
Linehan, yes.
Macaulay, no.
Macaulay, no, but Silva, yes.
Okay. That sounds good.
I tell the dumpsters.
It's our favorite part of the job.
Update on the restaurant?
Yes,
Closes?
so as kind of a part of this ongoing discussion, you know, food safety is a very big part of our jobs, and we want to make sure that, you know, residents know that we take this very seriously. Actually with us tonight is Michelle. She is one of the state-approved food safety consultants. She's worked with several of our restaurants in town. She's done a great job, you know, providing advice and working with the staff. She actually worked with Lisa's Pizza here and several other places in Wakefield.
Yeah, I have I'm actually here to say thank you for the way Wakefield town work, because I have worked in other towns and I have served many towns, and I really have to give, you know, a big applause how they work and the way they do it, because sometimes, you know, I work in municipality and we also have businesses, and I'm also a food safety consultant, so I can see all the directions, you know, and a lot of people that are business owners or people that work in the restaurant business, sometimes, you know, it's a lack of communication due to language, due to culture, a lot of, you know, a lot of time there's mistake because you just don't know, you just used to something, and maybe, you know, so the way they approach is, you know, the way they cite all the violation, but at the same time, it's not that they don't care for the public, you know, so I came here to say thank you to them, and thanks to them, the way all the restaurant I have worked specifically here, you know, they, like, I remember for Lisa's Pizzeria, I know they were gonna be shut down, and they're like, no, I will give you the opportunity if you have a consultant going to work and they have to speak the language of most of your employees and all that. So that is a big, like, I cannot even thank you enough, not for the work that I do only, just because, like, I started doing this because my mom got really ill and I spent over 2 months on a coma due to a foodborne illness. So for me, it's personal. So when we train everybody on procedures, you know, monitoring, control, verifying the way we have to treat food items, and, you know, and everybody around us when we handle food, is a big priority. And it should be, you know, it's a mandatory thing for us to teach and to know when we are doing the work. So thank you. I think I talked to her, to Erin one time. I think I stopped one time, and so I just want to say, like, I work with Lisa Pizzeria and Blue Moon, and they've been updating a lot of stuff. Kings of Flavor too. So, you know, so there's been a lot of changes. So, you know, I work with 3 of them, and they've been progressing, and the good thing is I keep track. I have like they have to send me every day monitoring temperature, the master cleaning schedule, little details that before they didn't know. At the same time, also business owners, sometimes they're just business owner, they're not present. So now they understand that they have to have opening and closing procedure, that even though they're not there, they already train a PAC, and they have to follow and also report to the business owner, which, you know, that's a big, some business owner, I know it's very uncomfortable for them, but, you know, it's at the end of the day, we just have to protect all of us and all the community. So I just came here to say thank you.
Yeah. Thank you.
I wish Dan was here to hear it.
Yeah.
Yeah. I know you've worked with Dan a lot too.
Yeah, Dan, like, he's awesome. Like, he's awesome. You know, I love when someone has a lot of attention to detail. And I also like, you know, when someone works with intentions. You know, it's different when you have someone that they just, oh, I just want to close down these restaurants, I just don't like them. It's different when you know that you gonna enforce a violation, you're gonna do something because there's a need, but he's also providing you guidance and opportunity for you to fix it, do the right thing. So, you know, that's Board of Health here in Wakefield, you guys have that. So
thank you for bringing that to our attention. Erin, I see your hand.
I was just gonna say that, you know, Michelle provides a service that I wish every restaurant had. It's, you know, she teaches them, and then she teaches them how to implement it in their operation, which is hard because a lot of times there's a disconnect between, you know, the serve safe class and then going back into your kitchen and actually implementing those things that you learned. And Michelle really like brings all of that.
Yeah, I don't teach, I'm a proctor. And when I was a proctor, that I knew what a proctor was, I was like, I can't be a proctor only. I have to be instructor because I need to train, because I need to train. Like, it is no purpose of me putting someone to take a test if you don't practice, if you don't understand the logic and the science behind that. And another thing is, you know, I speak other languages and I travel a lot. So I do understand also that food codes are different. And there's a lot of things that we do in other countries that are not safe for us to do it here, but we have to understand a lot of people work in the industry here that they maybe never have a refrigerator at their home. Maybe they never even have a stove at their home. So, you know, they come here to work and they just put them to work and they don't train them. And then, oh yeah, take a test, but does that gonna help? No, it's not gonna help. I mean, I believe. So I'm a believer of training and training on site. So you know your ingredients, you know the operation, you know your space, you know your equipment, and you learn how to use the equipment. You learn how to clean, how to properly clean and sanitize equipment, which I always tell to them. I'm like, you just have to give me time, because before I start, I just need to teach them how to properly clean and how to properly, they can have a personal hygiene. Like, I can be a little difficult for some people, but it's okay. Then they will get it. They will be happy, because sometimes, you know, it's just little detail that you have to understand when we handle.
Well, they have to invest in food safety, and you know they have a big responsibility, and you're showing them how to put those things into practice. And behavior change is so difficult, and the daily reminders is what they need. That's, you know, what we can't provide.
Yeah, so thank you. Yeah, you guys make a huge impact.
Yeah, I just want to say, again, thank you for all the work you've done so far. Health education and health equity are two things we take very seriously in food. You know, the food safety piece is really important. We want to provide education. You know, like she said, shutting down restaurants doesn't really do a whole lot unless it's paired with education opportunities. And also from a health equity standpoint, it's really important for us because, you know, there's many multilingual staff and owners in Wakefield. We should be proud of that. We have a lot of businesses that are owned by minority owners. And so something that we want to make sure that we're doing is providing them the best chance to succeed. And this is the best way to do it when we have someone that can connect with the staff and be able to train in a language that they're comfortable with. That's a big part of our mission. So I'm glad that we can.
Thank you for your work.
Thanks for coming.
Yeah, thank you. Yeah, thank you very much. I just came because, you know I first met Erin. I just like, I have to take a chance and go when I start working with Use of Flavor. And then I met you guys. So thank you very much. I appreciate it. I just came to say thank you.
Yes.
Thank you so much. Michelle, this is old school, but do you still carry cards? I mean, if someone was asking for,
yeah, I do. I carry cards because I'm a little old, so I do every day. I'm always, I have my agenda, so I work with my agenda.
I think I have them because we can get them through them.
But you know, I just, like I say, the work they do is awesome. Yeah, so I really kudos to you guys. Yeah, thank you. Thank you.
It's nice to hear that the steps we've put in place work. And that they're very well admired, and that we do succeed in something. I think the people, when they get the consultant, learn so much more. Yep. And it is true. You go for that test, and then you walk out, and then you go into a kitchen. I mean, I remember taking the test and going home and going, "Oh my God!" like this, you know. Everybody doing it. Yeah. It's glad to hear. Kudos to Erin and Dan that somebody's recognized, and to Anthony to make double sure, and Cindy who make sure we have those things right in order, let me tell you. But it's we should be very proud coming from a health background.
And I think she made a good point that it's not to be punitive, right?
Yeah.
This is supportive. Like this is like offering education and opportunity for correction, and it's not punitive.
They get something out of it. They really learn. It's a learning experience.
Yeah, it is.
Is there anything else? Anything else further?
No, I just wanted to take this chance to acknowledge Jonathan Chines is on with us tonight, our Board of Health liaison to Town Council. Thank you again for tuning in. I'm sure you were enthralled by our dumpster discussion. But yes, thank you again for tuning in.
No, thank you very much. I appreciate all the work that you do. And, you know, the details are enthralling. The stuff's important. So thanks for taking the time on it.
Yes, and then Jonathan, also I want to say thank you. He stepped up to give kind of the opening speech of the recovery event.
Yes,
He was able to make it just due to sickness. So yeah, again, thank you. You're much better off the cuff than I am. So
no, it really was it was such a great event, and I, you know, couldn't be more inspired and more proud of, you know, the brave people that kind of stood up to talk about, you know, their journey and what they've faced. And so I really appreciate you know, the department for helping to organize that.
And then the last bit of news I wanted to share was not necessarily an employee of the health department, but Tracy Rizzo, our recovery coach here in Wakefield. She works very closely with the police department. She was a former employee of Elliott. We are sad to say that she's leaving Wakefield, but she is joining us in Stoneham. She's filling the social services coordinator role. So you guys know Jason Stone is our social services coordinator here. A role that's been in place for over 2 years now, very successful, you know, has helped a lot of families in our community connect to services. It's inspired other towns to do so, and Stoneham is only the latest to do that. So we are forming a new position in Stoneham, and we're very excited to have Tracy join us there. So a loss here, but
are we gonna hire
gain for our region? I believe that there is Elliot will be looking for a replacement.
So that would be a shared position, like a number of the positions we do at Tri-Town?
Yes, so previously the setup was, I believe it was like 20 hours Wakefield recovery coach and 20 hours in Stoneham. And now that position is, we have a full-time position in Stoneham, and Wakefield will be looking to fill the part-time 20 hours they had already, so.
So it was Stoneham that increased it up to 5 because they felt the need. Oh, that's good. It's good to know.
And the social services coordinator position will also include recovery services.
Will include what?
Social services will also include recovery services because that's in Tracy's skills.
She did a nice job to recovery.
All right, do you want to set a date for the next meeting? Sure. Is there any other?
I do have a question on the business. I didn't get a chance to review them. We have a family member in the hospital, so but some emails came in that people were looking to have addressed. I think there were 2, 3. I'm sorry, I didn't get a chance to really check it out.
Oh, these were emails, I believe, from Julie Scott, license.
Yeah, they wrote from Julie.
I believe so. There was one email, I believe it was about the Wakefield Healing Spa, and then there was another email separately about the fever issue. Yeah. So I'm happy to go through that. Actually, Dan responded to both of those emails today, but just to clarify, there were some concerns over the Wakefield Healing Spa, which is a spa that a bodywork establishment that we actually permitted. There was a fire at the Four Corners. Remember this? This is about in spring. Yeah. So this was post-fire. They applied for a permit for bodywork. It was actually after the board adopted the new bodywork regulations. So it was a more stringent regulation. And so they went through the application process. We did an inspection, Aaron and I did an inspection relatively recently.
So that's something you're already addressing.
Yeah, so we addressed.
Yes, we permitted them. They had a good inspection.
Yeah, so there were just some concerns about the hours. I guess there were some irregularities between their posted hours and like web hours on like a third-party website, which you can't verify either way. So we just said that, you know, the hours that they've told us is what they've posted, so that's what we're going to go by. The information regarding the business at the state level, so there was a question of if they have a massage license from the state. We don't require one because they've told us they're only doing body work, and massage is a state regulated process, and they're saying they're not doing massage, so there will be no need to do massage services until we find out otherwise. They said they're not doing massage, so there's no need for a state permit. And then I believe there was hesitation regarding inappropriate advertising on a third-party website. Again, it's difficult for us to verify because that website seems to just collect information from other places, so we can't say one way or another if they're posting on that website. The advertising that they're doing through their own website does not violate any of the regulations that we put into place. So at this time, we don't have any reason to believe that there is any issues. So that was the original concern for the Wakefield Healing Spa. If there are other concerns with it, we're also happy to address them, but those are the initial questions that we received.
Anthony, I can talk about beavers if you want.
Beavers, yeah.
Oh, yes, please go ahead, yes. Please cover
so when we do have a beaver issue, which is probably once like every 2 years, if it's determined to be a public health nuisance, so meaning if it's causing flooding or, you know, damage to people's property, we do have the authority to issue a trapping permit. And that is done with through the Division of Fisheries and Wildlife at the state level. So sometimes we call them, sometimes we don't, but we work with a problem animal specialist and trap the beaver. And that's usually done with the help of the engineering department or DPW and the Conservation Commission. We include on everything as well, regarding the beavers, but it's something that's, you know, regulated at the state level, and we have the authority from the Division of Fisheries and Wildlife.
And by state law, I mean,
yeah, so that's what dictates the policy. It's not really anything town regulated at the town level. It's all, you know, based on the state guidance.
Correct. We're all restricted from obviously hiring wildlife, but there is an exception made for beavers and muskrats. Should they pose a threat to human health and safety, that would include flooding that could cause issues for someone's house, where someone's living. So that would be the exception, and that's why we would take action on approving a trapping permit. Any other scenario?
I just, as a new member, didn't really understand how it happens. Like when the emails come in, how they're addressed. Like, do you decide if they go on you deal with them, or if they go on the agenda? If
it's more of like an operational issue and an implementing of our regulations, then we generally would deal with it. But if it's more of a concern of like someone wants to change a regulation or someone wants to, then that would be the purview of the board to then maybe have a discussion about, you know, if someone wanted to change the dumpster permit time, then they would reach out to us. That would be a board decision. But if it's more of the implementation of the regulation, then that would be.
Usually Elaine would respond. I respond if it would be something that I would respond to. Most of the emails that we do get question, you know, something that he would, and if you notice, Anthony will answer a lot. Erin or Dan will answer if it has to do with food. We wouldn't, and they really do them. And we don't really get much at the board. They may mention something to us and we'll see it. And if I see something, Anthony will tell you, I'll be on the phone to him and go to him, did you read that email? What do you want to do? Or I'll forward it, say, listen, let's read this, or will this be brought on, or asked to be on the agenda? Right. I've asked many times for something, could you look at this and let's put it on the agenda for the next meeting? You know, if I feel that it's something that we're gonna have to look into and take a vote on and go. But most of the time we're pretty good. We have a health department that's really on the ball and answers those emails pretty quickly, I think. Yeah, I agree.
And again, if it comes up,
I'm just curious.
Yeah,
I have no.
If you have a question, don't be afraid to say. You know, like if you get it in and just put on the reply, you could even the reply all to us and say, hey, okay, I don't understand this. Where is this going to go from here? Are we going to bring this up? Or I feel that I'd like to have this on the agenda, and then we'll just pass it on to Anthony and just do it that way. Okay. Don't be afraid to ask questions. Never hurts to ask a question. I forget who the famous person was that said that. I have to go back and look and see.
And that was different questions.
Yeah,
something like that.
No, questions are never not accepted in my book. Always ask a question. I'd rather have you ask a question than have something happen because of it.
Anything else?
The next meeting would be, am I correct, on November, am I saying it right, the 20th something? That would be the third Wednesday. It's the week before Thanksgiving. Is that okay, Anthony?
The 20th?
Yeah.
I believe that should be okay, yes. Yeah, I don't know.
And hopefully, if everything goes right, then if we don't have anything for December, we'll probably kind of pass on a,
Yeah.
December, because
Well,
that would have to be, that would be the 18th or something, if we have something come up, but normally we do take at least a month off during flu season to give everybody a little bit of a break. So hopefully we can hold off to December.
Yeah. Wait, hold off.
We can do November, or we can
Oh,
hold
I
off
got
on
it.
the one in December, most health departments don't have them.
That's okay. Well, we put you guys to
And
work.
follow tuition. I follow what I think, what's happened in the last 25 years.
Yeah. So, yeah, November 20th sounds.
November 20th, right here. Any other questions? Okay, can we have a motion to conclude the meeting? Okay, second. Second, all in favor? All in favor?
William, aye. Macaulay, aye.
Aye, and Silver, aye. Thank you very much, everyone. Thank you, Erin. Thank you, do you want me to hit it? Okay, we're closed. We're closed for business tonight.
All right, thank you, Erin.
Mr. Chines.